Aibovan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. Our objective is to promote awareness about good health, and why we keep doing these programs in the midst of a raging pandemic is so that you, our beloved viewers, don't neglect your other health issues. So today we'll be talking about the type of stones. Certainly not the type that you find in Ratnapura that can earn you millions of bucks, but the type of stones that will occur in the human body. And these are none other than the Gall Stones. So talk about this topic to share his expert opinion, we have a special guest with us here in the studios. He is Dr. Pramodh Chandrasinghe, a consultant surgeon who is attached to the Colombo North Teaching Hospital. He is also a senior lecturer in surgery at the Ragama Medical Faculty. A very good evening to you, sir.
Good evening, dear Shan, and thank you for having me at Healthline.
It's a pleasure to have you, sir. So, to get down to the topic at hand, before we go into gallstones itself, let's discuss about what the gallbladder is. If you can explain to us the anatomy of the gallbladder and where it's situated, and also the surrounding structure, so that our viewers can get a better understanding of what we will be talking about.
Yes, Dilshan, let me start with a more familiar background. So, everyone knows the liver, the largest solid organ in the abdomen. And this liver has so many functions like storage, metabolism, and excretion. So, one such component that the liver secretes is bile, which is a golden brown color liquid which helps in the digestion of fat. And liver has this system, the tubing system that transmits bile into the early part of your small bowel, which we call the second part of the duodenum. So these start as small bile canaliculi, and then the right and the left side of the liver has two main hepatic ducts which come and connect to form the common bile duct. And the common bile duct takes this bile into the second part of the duodenum, and at the last bit the pancreas joins in to make a common channel. And in the proximal part, where the common bile duct is formed, you have this pouch hanging out, that is the gallbladder. And gallbladder hangs onto the common bile duct from a narrow duct called the cystic duct. And it is basically situated underneath the liver if you look into the abdominal cavity of a human being, and it's sandwiched between the liver and the first part of the duodenum. It is usually a grayish white color pouch and has a thin wall and a very thin muscle layer in its wall.
So, it's basically a pouch-like structure which is underneath the liver. So, let's talk about the function of the gallbladder. What is the function of gallbladder in human beings, and also is it essential that we have it for human bodies to function?
Well, its function is it is a temporary storage device. So, bile is stored in the gallbladder because you don't need continuously bile flowing into your small bowel, and bile is specially needed for the digestion of fat, so after meals. So, at the end of the bile duct, I explained earlier, there is a tap or a sphincter which prevents the bile from continuously flowing into the small bowel. And then the gallbladder stores about 50 milliliters of bile, and what it does is it complements the supply of bile after you have a heavy meal. It contracts after meals and helps in providing a large dose of bile into the duodenum. And as you know, bile supports in digestion of fat by sort of breaking fat into small droplets. It's exactly what happens when you put a little bit of soap into a pan with oil. You can see the fat droplets breaking in. So like that, bile breaks the fat into small droplets and makes it easy for your enzymes to digest the fat and absorb.
So, if I may recap what Dr. Pramodh said, gallbladder is a pouch-like structure underneath the liver, and it stores this bile. Bile is what helps in digestion of fat in your dietary intake. So, before we move on to the topic of stones itself, our viewers would like to know, sir, what this bile consists, what are its constituents?
Right, so bile has three main constituents. One is cholesterol, and then there are phospholipids, lipid and protein molecules, and then the bile pigment. The bile pigment is what gives it the golden brown color. So all these three are being secreted from the liver, And these are the three main constituents. Apart from this, the gallbladder might also secrete some mucus to add into it to increase the volume.
So, it has multiple constituents. Now, let's move on to gallstones itself. So, what are gallstones? Because we know bile is something that is there in liquid form. So, when we talk about gallstones, what are these gallstones and how are they formed? And also, are there different types of gallstones?
Yes, Dilshan. So, we call a gallstone any stone that is formed inside the biliary tract, but a vast majority of these stones are formed inside the gallbladder. You can rarely have stones forming inside the bile ducts, right? So, in bile, as anything in the human body, these three constituents that I explained earlier, the cholesterol, the phospholipids and the bile pigment, they are in harmony, right? They are in their right concentrations, and then the bile remains in liquid form as long as they are in their right concentration. So, if one component increases its concentration, then we get what you call supersaturation, right? When a liquid is supersaturated with one component, it starts forming stones, right? So, the answer to your question, do we have different types of stones? Yes, we have cholesterol stones, we have pigment stones, and we also have mixed stones, right? So, depending on what component increases in concentration, the constituent of the stone also differs.
So, like you said, it's the harmony of these constituents which makes the bile function in its natural state, but if there is some supersaturation of one component, then the gallstones tend to form in the gallbladder. So, gallstones is a condition that is quite common, but when we talk about prevalence, how prevalent is it globally? And when it comes to Sri Lanka, how do we compare? Is it something very commonly that you see in your practice as a surgeon?
Yes, so if you take the normal population, about between 10 to 15% of the population will have gallstones, right? But these figures are based on Western literature. If you ask me the specific numbers for Sri Lanka, I should say we have not done a large scale population based study to evaluate the prevalence of gallstones. But there are few studies that are being done with regards to the constituents of the stone. Now, we talked about different types of stones earlier. So, in Western literature, the commonest type is cholesterol stones. But in Sri Lankan studies, there are two studies coming from the western and the central parts of Sri Lanka. What they have identified is that Sri Lankans have pigment stones most commonly rather than cholesterol stones. So, there may be a difference in the pattern of stones that we see in the Sri Lankans, but as you said, in our practice, of course, we see gallstones very commonly. It is not a rare condition.
So, we spoke about the prevalence of gallstones, even though we haven't done a population based study. For our intents and purposes, it's a very common condition. So, which is why you, our viewers tuning into TV1 should pay attention, because you never know, you may be facing this and you may be missing out on certain signs and symptoms if you do develop it, and which is one of our objectives, so that you, our viewers, know what to be on the lookout for. Now, we spoke about urinary stones previously on Healthline, and we saw that males were more prone to develop urinary stones. Does it still hold true for gallstones as well?
Actually, Dilshan, it's quite the opposite. Females have a very high prevalence of gallstones. In the Western populations, it's being said about females have about a 10 times higher risk of developing gallstones. But from the few studies that are being done in Sri Lanka, they report about 3 to 4 times higher risk of females having gallstones compared to males.
So, females do have a 3 to 4 times higher risk of developing gallstones when compared to men. So, when we were medical students, we were taught as risk factors for gallstones as fair, fertile females above 40. Does it hold true in real practice, in your day-to-day practice, or what are the risk factors involved with developing gallstones?
Right. I would say that statement is partly true. because, as we discussed, female sex is one of the risk factors to develop gallstones. And then the white Caucasian race. There are some races who are more predisposed to develop gallstones. The white Caucasians, and then the Hispanics, and also some Native Americans. And also genes. Genetics is the biggest risk factor for you to develop gallstones, because we spoke about supersaturation, but we exactly do not know why some people get formation of stones and why some don't. So it is believed that genetics play a big role. And if you dig deep into the history of these patients who have gallstones, you might find they have family members who have had gallstones. So your genes also play a role. And then pregnancy. So if you have had multiple pregnancies, that again increases your risk. There is a scientific basis for this, because during pregnancy, because of the hormones, the gallbladder contractions tend to be inhibited, right? So there is a long period of stasis of bile in the gallbladder, which increases your risk of developing gallstones. And then obesity has been linked. If your body mass index is higher, you have a higher risk of developing gallstones. And then there are specific disease conditions. Patients who have had their small bowel resected, the last bit of their small bowel, which we call the terminal ileum. When you resect the terminal ileum, there is a reduction in the absorption of the bile salts, and so there is a high risk of gallstone development. And also in patients who have blood disorders with an increased breakdown of blood cells, you get the pigment stones, because the bile pigment, or the bilirubin, is a byproduct of the metabolism of hemoglobin. So if you have such a disease, there is again a higher risk of developing gallstones. And again, patients who have diseases in their biliary tract, which causes obstruction and stasis of bile, are again at a higher risk of developing gallstone disease.
Now we see that dietary habits and alcohol consumption plays a major role in so many diseases. But when we talk about gallstone, are there any specific dietary habits or any alcohol consumption which predispose towards this condition?
Well, high fat diet and high carbohydrate intake has been linked to gallstones, but no one has been able to prove a causative relationship between the two. But of course, we see there is a correlation in people who take a high fat and high carbohydrate diet in developing gallstones. When it comes to alcohol, the evidence is very controversial. Still, we don't have a verdict on that, but there are some reports which suggest that there is no link, and some reports saying there is a reduced risk with a moderate intake of alcohol. But we cannot give a verdict on that, so it's better to avoid considering the other benefits of alcohol. But if you have a disease condition like cirrhosis due to excessive intake of alcohol, then you are at a higher risk of developing gallstones.
Right. Now moving on with our conversation, sir, these patients who do develop gallstones, we see that in certain patients these gallstones remain for years at end without causing any symptom. We call these silent stones. But when it does cause symptoms, that is when there is a cause for worry. So for the benefit of our viewers, can you describe what the gallstones itself, what kind of symptoms can it cause?
Right. As you rightly said, Dilshan, majority of people who have gallstones are symptomless, right? I said about 10 to 15% of the population will have gallstones, and out of that about 90% will be silent. So in people who have symptoms, the most simplest symptom, we call it a biliary colic, right? So when the stone comes and obstructs the gallbladder, the pressure starts building up inside, and the patient will complain of usually pain in the right upper abdomen, the area which we call as the right hypochondria, or the pain may be in the upper abdomen in the central region, which we call the epigastrium. And this pain usually starts after a meal, few hours after a meal, usually late at night or early in the morning. And this pain will last for somewhere between half an hour to 3 to 4 hours time. It's a nagging pain. It can be associated with nausea, and sometimes you may even vomit, right? and then it spontaneously subsides. And a patient with gallstones might get several attacks of this pain with long intervals between the attacks of pain.
So, if I may recap what Dr. Pramodh just said, if you do develop a pain in your right upper abdomen, which may last from anywhere between 30 minutes to 3 to 4 hours, and if it does develop after a meal, we may be looking at a case of gallstones. So, if you are indeed facing such symptoms, it is best that you get help from a qualified medical practitioner. Moving on with the questions, when a patient presents to you with this symptom profile as a surgeon, what are the alternative diagnoses you would consider, or are these symptoms very specific to gallstones itself?
No, it's a very important question. They are not specific. So, this kind of pain could be due to other common conditions like peptic ulcer disease. If you have an ulcer in your stomach or your duodenum, you can get a similar type of a pain. If you have reflux disease, again, acid reflux into your esophagus, you will get the same type of pain. And also, pancreas is lying in the same, your pancreas is lying in the same region, and any abnormalities in the pancreas, even conditions like acute pancreatitis would give rise to a similar kind of pain. And also rarely, if there is an obstruction in your colon, we know the hepatic flexure, one of the bends of the colon reaches right up to your liver, and if you sometimes even tumors in the colon might give rise to similar kind of pain. So it is very important for you to get medical advice and differentiate rather than assuming that this is due to gallstones.
Definitely. If you viewers remember, we had an episode about gastritis, and we specified that these symptoms can mimic so many other conditions as well, and one such condition is gallstones. So, but these symptoms, like Dr. Pramodh very correctly said, may mimic very severe, more sinister conditions as well. So, best thing is, if you are indeed facing these symptoms, to go and seek medical attention. Now, gallstones can cause certain complications. So, let us break it down to complications which can occur within the gallbladder itself, and complications that can be caused outside the gallbladder. So, if you can elaborate on what can happen within the gallbladder itself because of these stones?
Yeah, so as I explained, you can get a biliary colic when a stone obstructs the gallbladder, the outlet of the gallbladder, and if it falls back into the gallbladder, your pain spontaneously settles. But if it does not, it can cause irritation of the gallbladder and inflammation, what we call acute cholecystitis. And then secondarily, infection sets into this. And this can get very bad if you are especially immune compromised, or if you have diabetes, and the infection can lead into accumulation of pus, and sometimes the pressure can even cause part of the gallbladder to die off. We call necrosis of the gallbladder, and perforate and then spill the infective material into your abdominal cavity. And also, if you have long-term gallstones, sometimes they can cause subclinical irritation of the gallbladder and cause the gallbladder wall to thicken, fibrose and contract, and also sometimes accumulation of calcium in the wall, a condition which we call the porcelain gallbladder. So both these can happen due to stones being there in the gallbladder for a long time.
So these stones, if they remain silent, as long as they do, then it's not a cause for worry. But as we are discussing about the complications, as you can see, it can cause some severe complications as well. So moving on to possible complications when these stones go out of the gallbladder, because we know that they don't always remain within. If it does pop out for some reason, what sort of complications can we expect?
Yeah, so when the stones reach outside of the gallbladder, the complications are more severe. If it goes and blocks the common bile duct, as we discussed earlier, so the bile flow from the liver into your duodenum gets obstructed, and there is back pressure, and this is a serious condition, right? And also secondarily, you can develop infection on top of this. So we call this obstructive jaundice, and when the infection sets in, we call this cholangitis, right? So what the patient will have abdominal pain associated with what we call jaundice, the discoloration of eyes, and the urine will be dark, and also you can develop very high fevers with chills, and it can lead into sepsis and even multi-organ failure and death. And also, if the block is further down in the common bile duct, it can also obstruct the pancreas, the outflow of the pancreas, and this can result in pancreatitis. This is called Gallstone Pancreatitis, and again a disease with a very high mortality rate. Rather than when you have acute pancreatitis due to unidentifiable causes, when you have a gallstone pancreatitis, the severity is much more. So other than these two, very rarely, sometimes if you have a large stone, a very large stone, that can erode through the gallbladder wall and get into the small bowel, right? As we said, the gallbladder is sandwiched between the liver and the first part of your small bowel, the duodenum. So a large stone can erode through the wall and get into the small bowel and cause obstruction of the bowel, which we call gallstone ileus, but this is a very rare condition.
So, as I keep on reiterating, if you don't get timely medical attention, gallstones can lead to very severe complications. Now, when a patient presents to you with either one or many of these symptoms, what would be your approach to this patient, and what kind of testing or investigations would you employ to come to a definitive diagnosis?
Right. So, when a patient comes with biliary colic, as we discussed, the most simple form of symptoms, ultrasound scanning is one of the most useful modalities of investigation. It can show you the presence of stones in the gallbladder and whether there are changes in the gallbladder, and also it can show you the biliary system, whether it's dilated or not, and also the state of your liver, right? Apart from this, as I mentioned earlier, gallstones can be a common occurrence or an incidental finding. So to exclude any diseases such as peptic ulcer disease or reflux, we also usually offer them an upper gastrointestinal endoscopy, because if you see a peptic ulcer, and patient is having gallstones in the ultrasound scan, it is more likely that the patient is having symptoms due to the peptic ulcer, and the gallstones be an incidental finding. Apart from these, we do some blood investigations to look at your liver function, right? Basically, if the liver enzymes are elevated and your bilirubin levels are elevated, that indicates a blockage in the common bile duct. So these three are basically the first line investigations that we order, and if the patient comes with a complication, as we discussed earlier, again acute cholecystitis can be very accurately diagnosed with ultrasound scan associated and also with blood investigations like a full blood count showing your white cell count to be high, and the CRP, what we call the acute phase reactant, it will be elevated. And if we suspect an obstruction of the biliary tree, then we will resort to more complex investigations such as MRI scans. It is called a MRCP, a magnetic resonance cholangiopancreaticogram, which will show the entire biliary tree and any place of obstruction. So this investigation will also be combined with a CT scan just to exclude any other abnormalities in the pancreas or the liver. So these are basically the basic investigations that we use to either diagnose symptomatic gallstone disease or to manage complicated gallstone disease.
Now, we have broken down possible complications of gallstones into the gallbladder itself or any complication outside, and we have spoken about the possible symptoms of each and also how to come to a definitive diagnosis. Now, as a surgeon, what kind of treatment modalities would you offer to each of these types of conditions?
Right. So before I answer that question, Dilshan, this is a general guidance on the treatment modalities. The best person to decide the treatment modality for you will be the surgeon who is treating you, because there are multiple factors that come into play when you decide the management plan for a patient, right? So under general guidance, if you find asymptomatic gallstones, we usually don't offer them treatment, right, if it's an incidental finding in the ultrasound scan. Having said this, there are other factors that might prompt your doctor to offer you treatment. So it's very important to have a discussion and personalize your treatment. If it is symptomatic, of course, then we offer treatment. The basic treatment for symptomatic gallstone disease is removal of the gallbladder, or what we call the cholecystectomy, right? If you have a complication, as we discussed, acute cholecystitis or inflammation or infection of the gallbladder, there are two options. One is you can directly go and take out the gallbladder if the patient presents within the first 72 hours. It is possible to take out the gallbladder laparoscopically. Or else you can treat the patient with antibiotics and let the infection settle in, and then go in after about 4 to 6 weeks time and take out the gallbladder. It's important to take out the gallbladder because to prevent another attack, because as long as the stones are there, you will keep on getting similar attacks. And if you have a complication due to a stone dislodging into the biliary tree, then just taking out the gallbladder is not enough. You need to treat the obstruction or else take out the stone. So for this, we use multiple modalities. The commonest form is called Ercp. It is an endoscopic procedure, what we call endoscopic retrograde cholangiopancreaticogram. And what we do here is you put in an endoscope through the mouth and go into the second part of the duodenum and enter the biliary tree from the opening that you can see through the small bowel. And then we could inject a dye into this and see the level of the obstruction, and also send small baskets or instruments through this, and then extract the stone out. And also you make a small opening in the mouth and allowing any other stones that are blocked to come out easily. Or else you can put a stent in, a plastic tube, to relieve the obstruction. You do that, and then you have to take the gallbladder out, because as I mentioned earlier, vast majority of these stones, almost all stones, develop in the gallbladder. So you need to take out the cause. Basically, these are the treatment modalities. Other than that, there are some more advanced treatments such as choledocoscope. During surgery, you can put in a small endoscope with a camera into the bile duct and clear the bile duct. And options such as these are open extraction of stones, which is very rarely done these days because we have these minimally invasive techniques available.
So you mentioned about these minimally invasive techniques. I think it would be very beneficial for our viewers to know that with the advancement of surgical techniques, that minimally invasive procedures are employed for the treatment of gallstones. But are there any occasions where we would have to go for an open surgery as well?
Yes. Vast majority of cholecystectomies globally are done laparoscopically, but there are special occasions where your surgeon might need to make a cut and take out your gallbladder. If the gallbladder, the infection is severe and your gallbladder has got stuck into the surrounding organs, and it's difficult for you to dissect it with small instruments through keyhole surgery, then that's an indication to go in. If the gallbladder wall is too thick and it's difficult to capture with the instruments, again we tend to go in. And also if there is a cancer of the gallbladder, then again we resort to open surgery. During laparoscopic cholecystectomy, if you run into any problems, again your surgeon might decide to convert it into an open surgery for your benefit, because safety is number one.
So for all intents and purposes, we do try to go for a minimally invasive technique, but if the complications are higher, then we might have to go for an open surgery. So now you mentioned that we will be removing the gallbladder, the entire thing to be resected out. Our viewers might be having a certain confusion. When we take an entire organ out, would the human body still be able to function the same way it used to?
Well, there are a few organs that the human body actually don't mind living without. One such is the appendix and the gallbladder. Having said that, nature has created these organs for a purpose, so we do not go taking them out without a valid reason. When you take out the gallbladder, actually, during the initial period, the patient might experience some symptoms, like he will not be able to tolerate a large fatty meal. You might develop diarrhea because you can't digest the fat, or you might experience bloating and some abdominal pain. But within 3 to 6 months' time, your body generally adapts, and it does not require this temporary storage. As adaptation, it sometimes dilates the biliary tree and use it as a temporary storage. So it is not absolutely essential to have the gallbladder. In other words, a patient who undergoes a laparoscopic cholecystectomy does not complain of severe symptoms or face a serious reduction in quality of life.
So, if I may recap what Dr. Pramodh just said, the gallbladder, even though it is a part of our human anatomy, if there is an absolute indication, we have to take it out, and when we do, for a certain period of time, you may face certain discomforts, because like we mentioned, the bile which is stored in the gallbladder is responsible for the digestion of fat in our food. So, for 3 to 6 months, you may face certain symptoms, but then the human body adapts to live without it. So, for the benefit of our viewers, if they do have to indeed undergo surgery, how would they have to prepare themselves, and is it a long and arduous procedure with very long post-operative recovery time, or is it a very simple procedure where you can just walk in, get it done and walk out?
Yeah. So, as I said, a vast majority of cholecystectomies are done through keyhole surgery globally, and this is one of the most common surgeries done nowadays. And when we say laparoscopic cholecystectomy, what basically we do is we make a small incision at your belly button. It will be about 1 centimeter size, and the camera will go in through this, and you will have about 2 or 3 more incisions in the right upper abdomen. These are all less than 1 centimeter in size, and then we will be using small instruments to dissect, and then the gallbladder will be taken out from the incision you made at the belly button. This is a very safe procedure, right? And usually the hospital stay is about 24 hours, right? You get admitted today, you get the surgery done, and if there are no complications, you just leave tomorrow. But as I mentioned earlier, if the surgeon has to convert the surgery into an open surgery, then sometimes you might have to spend a couple of more days in the hospital because the pain has to be managed and so on. But even then, the cut does not significantly reduce your quality of life in the years to come. So all in all, it is a very safe surgery, especially because now surgeons have evolved, the techniques have evolved, and the technology has developed, so we can perform this surgery in a very, very safe environment.
So there you have it. If you do indeed have gallstones and you are experiencing symptoms, these treatment modalities have developed in leaps and bounds, where you don't have to spend days at end in the hospital, and you don't have to face severe pain. It, like Dr. Pramodh just said, it may just be a 24-hour hospital stay, if provided that there are no complications. So please do seek medical help if you do have these symptoms. But having said that, we see certain patients who are facing these symptoms tend to self-medicate. When they are having the pain, they would take a painkiller or resort to certain antibiotics, which may give them a certain level of comfort, temporary comfort I should say, and that would lead to even more severe complications, because you mentioned this 72-hour period for going into surgery. So if they do prolong this, what sort of repercussions would they have?
Yeah, so if you keep on taking oral antibiotics and sort of treating this condition half-heartedly, especially when there is infection, what we call it acute cholecystitis, what may happen is you can have accumulation of pus in the gallbladder, and then, as I mentioned earlier, with the pressure building up, it might perforate and you might develop peritonitis, right? So that is a serious condition, and you can go into sepsis and develop organ failures and so on. So it is very important, if you have these symptoms with fever, right upper abdominal pain and severe tenderness, it's very important to seek correct medical advice, because either you need to take out the gallbladder or give antibiotics intravenously to treat the condition. And also, if you have a stone stuck in the biliary tree, it can lead to very severe repercussions, as we talked about earlier, with cholangitis or Gallstone Pancreatitis, which could be life-threatening. So it is not advisable to self-medicate. And also, Dilshan, it's important to mention, as we discussed earlier, these symptoms may not be due to gallstones. So you may be neglecting a much more serious condition. It may be a cancer or something else that you are neglecting by self-medicating. So always seek medical advice from a qualified medical practitioner.
And there is one fact that we emphasize time and time again here on Healthline. If you are facing certain symptoms, don't try to self-medicate. Why we discuss these symptoms, signs and what we call red flags is that you have a better understanding on when to go and seek medical attention and not to try and self-medicate, because by trying to self-medicate you may be missing out on very severe and sinister causes which may be giving rise to your symptoms. Now, you mentioned cancer in the gallbladder. Do gallstones give rise to gallbladder cancers?
No, there is no causative relationship between gallstones and cancer. Gallbladder cancer is a very rare cancer. It is common in females, but the risk increases with age. And if you identify gallbladder cancer at a very early stage, your outcome is good. But the problem is most of the gallbladder cancers present late, because these do not give significant symptoms, as we said earlier. The symptoms that the cancer give may be also similar to a biliary colic. So when you diagnose the cancer at a later stage, the outcome is poor, and the only option available will be surgery to take out the gallbladder with the cancer and part of the liver that's lying close by. And there is very minimal support with chemotherapy and other modalities.
With that, with our time constraints, we are coming towards the end of this edition of Healthline. So, for the benefit of our viewers, what would be your take-home message for our viewers, something that they should always keep in mind with regards to gallstones?
Well, gallstones are very common, and if you are found to have gallstones, it may be symptomatic, it may be an incidental finding. Seek advice from a qualified medical practitioner on what to do. And if you have symptoms, don't hesitate to meet your surgeon or your physician, because gallbladder surgery is very safe and the outcomes are very good from the surgery.
There you have it. Once again, it is very important that I reiterate this. If you do have these symptoms, seek treatment from a qualified medical practitioner. And with that, we come to the end of this edition of Healthline. We thank Dr. Pramodh Chandrasinghe very much for being here today and having this in-depth conversation with us regarding gallstones. And it is very pertinent that I share this message with our viewers as well. We as healthcare professionals are battling a raging pandemic out there in the front lines. So while you're watching this, take this message into your hearts. Even if you're vaccinated, you are still not 100% safe. You can still be a carrier who gives this dreaded disease to your loved ones. So take all the necessary precautions and maintain social distancing, all respiratory etiquette, and keep yourself and your loved ones safe. And with that message, I bid all our viewers a very good night, and until I meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Aibowan.